From Florence Nightingale to Netflix, nurses have walked hospital corridors and cinematic frames. But between fiction and frontline care lies a powerful truth. What we watch can change how we practice. Can a film scene change a protocol, influence empathy, or even push someone toward the profession of nursing? This documentary investigates how film influences the practice of nurses, clinically, emotionally, and culturally. While growing up, I had the opportunity to watch some medical documentaries and TV series portraying healthcare, tech, and other occurrences in the hospital environment. I was particularly fascinated by the fictional and emotional scenes in these videos, to the extent I dreamed of becoming a healthcare worker. After becoming a nurse, I realized that most of it did not really exist. Nurses, for example, were doing a lot of improvising on the ward, and I felt deceived by what I saw on TV. Media is a mirror, but also a molder. According to a study published in the Journal of Advanced Nursing 2021, 63% of nurses say TV dramas influence patients' expectations of care. Another 40% report changes in their own perception of the profession after watching nursing-centered films. In psychology, this is known as narrative transportation, when viewers begin to adopt attitudes shaped by what they watch. While leadership sets the tone, it's the staff nurses who lead the shift. Between patient care and pulse checks, how does film frame their experience? And does it leave a lasting mark?
Coming to the profession, I didn't have maybe any nurse, who is a mentor who can tell me what to expect. So the best source to go to is movies and other information elsewhere. So yes, to some large extent, I'm gonna say that movies shaped my perception of what nursing is about and who a nurse is prior to venturing into the profession.
Do you think the film industry is helping nursing to grow?
Yes, in a lot of ways, especially with the advent of technology. For example, in the past, for some nursing trainings to take place, the students would have to be there, or maybe the nursing staff that is undergoing the training would have to be there to have the training take place. But in today's world, we have got educational materials, self-help materials that are present in the form of films which people can watch and then also acquire those skills. A few other things we also have along these lines are documentaries that serve to expose or that serve to illustrate vividly what is going on in the profession, opening our eyes to various facets of the profession that one may not be aware of. Other things as well is public campaign awareness videos as well, about what nursing is about and about what nursing does. So films play a huge part in this as well. So in this way, film is really contributing immensely to the growth of the profession itself, shaping it and making it more into what it is today, creating the right public awareness about nursing and nurses. And then films as well, when used properly, it also encourages the younger generation to go into the profession and pursue it, showing that it is a cause worthy of pursuit.
What are the negative things in movies that do not portray the true image of nursing, and how can filmmakers imprint on their stories to suit reality? So
everything that's got a positive sometimes have a negative side as well. As much as films help the profession, help to create a public awareness of the profession, I think there are also a few things in movies that are negative. One of them includes the depiction of negative stereotypes of what a typical nurse should look like. portraying nurses to have a particular kind of temperament as well. And I think this is not healthy because it brings about an unrealistic expectation of how a nurse conducts themselves before the eyes of the public. And I have to say that, first of all, nurses are human beings with various temperaments before they are nurses. So sometimes there is no particular, in quotes, personality that can be attributed to a nurse, and in movies you do see this a lot. And then another thing as well is there's in most movies you find out that, in most films, you find out that the nurses are females, and then out there are male nurses as well. So that is one thing I think films will need to work on as well. And then something else that is also very important is the depiction of the struggles and the challenges of the profession. I don't think there is any one profession on the face of this earth that haven't got its own challenges as well. But sometimes the challenges in nursing can be blown out of proportion, and this goes a long way to discourage the upcoming generation from enrolling into the profession and training. So these are some of the these are some of the negative things that movies portray about the profession. So my personal recommendation as a nurse would be to people who are out there who are making movies, who are making documentaries, and then who are making all sorts of audiovisuals, for the purpose of public consumption. I think it will be very important to have a balanced view of what the profession is about. And one of the ways to really do this is to speak to a number of nurses, interact with a number of nurses, get the perspective of a number of nurses, not just one nurse, not two nurses, not three nurses, and also get to interact with nurses across various cultural backgrounds as well, and various trainings. And this brings about a balanced view and a balanced perspective of what the profession is about and of what the values of the profession are. And then other things I will also want to mention is it may be important for people who facilitate these audiovisuals to get in touch with certifying bodies of nursing as well. And I believe that these bodies, like the Nursing and Midwifery Council of maybe various countries or maybe various jurisdictions, they can also go a long way to give a more comprehensive insight into what the profession is about. And this would go a long way to give a more concrete depiction of the profession.
It is obvious that films influence people's behavior in many ways, either positively or negatively. Whilst we as healthcare professionals appreciate the filmmaking industry's contribution to healthcare, filmmakers must always be mindful that apart from serving as entertainment hubs for people, they serve as learning platforms for professionals as well. They should therefore strive to consult on specific protocols to make their storytelling more impactful. It's been McAfee.